patients don't want to just come and receive a service. It's about the experience when they're receiving that service. So fit has almost become more important than just the skill set.
We've been on Performance Manager fully live 1 year, and our engagement scores for that 1 year time difference from 2012 to 2013, we've increased in every area relating to performance evaluation.
Since the implementation of Performance Manager, our managers have been much happier because of the ease of the process, and the system is just so much more streamlined. But our employees are also much happier. There's a sense of accountability. They can ensure that their evaluations really mean something to the organization, and the managers are really spending a lot more time with the employees to give them important feedback on their performance throughout the year and helping them create also developmental goals.
Somebody could look really good on paper and they could interview really well, then you get their references back and they're low in this area, or their work ethic wasn't so good, they had bad attendance, they didn't react good in situations. So that gives you a better picture. It can go both ways though. They could look so on paper, they could be really shy in the interview, but they have phenomenal references. I really take value in those references when I'm making a decision.
Prior to us beginning to use the staff and the reference assessment, our managers were going into interviews blinded. They had 45 minutes to an hour with the candidate, and they were just asking, questions that they asked every single candidate.
You definitely get a better picture of the applicant. You kind of know what attendance, work ethic, skills that they have, or what they've shown in other jobs, and that will come through the reference assessment.
Now they're able to go into the interviews knowing which things that they need to focus on.
The staff assessment has really allowed us to make sure that we're hiring people that are compassionate, that appreciate diversity, that can take hold of change and look at process improvements.
With the leadership assessment, I think what we're realizing is that we are making better selections, and we're providing our leaders with the tools that they need to be successful, which in turn passes down to our staff. So the more successful leadership is, the more successful our team members are, which overall helps the organization.
The benefits that we've enjoyed from implementing staff assessment into our selection process has included retention. Our first-year turnover has decreased from 24.7% to 20%, which puts us at about a 70th percentile benchmark within our region. We've also seen greater consistency across the organization on how we hire, and everyone is asked the same questions according to their job family. And we've also benefited from the development report for our current employees and being able to have a structured program that allows us to provide training and development for our top performers that are really the ones that are having the greatest impact on our patient experience.
We are now paperless, no more papers to scan, no more keying in into our HRIS system. And also our HR staff, they're really excited about this, because before they used to be blamed for lost papers, and they used to be blamed for late, entry of data, and right now they don't have to, it's in the system.
And our HR staff really has enriched their job. It used to be a manual clerical task of scanning, filing, and now it's more techy.
The savings and the efficiencies that we've experienced by using Performance Manager has just been amazing.
It's not just about the technical skills, it's about finding candidates, new hires throughout the selection process that will fit into our culture. And I think with the staff assessment, we've been able to get more insight into the candidates and make better selections.
We have actually seen a decrease of our first year of service turnover by over 3% since beginning to use these tools. But the thing I am most proud of is our time to fill has decreased by almost 8 days.
If others asked me about HealthcareSource and I found out they weren't using it, I would say, what is wrong with you? I don't think there are other competitors that compare to the product or the customer service that's provided.
I do believe we have a very good partnership with HealthcareSource. since we have so many of the products, we've used different levels of different support in different areas, and never have we had any problems. They're so responsive, they're good to work with. I'd say the only downfall is I don't know what they look like till I come to the conference. But they're very helpful. I can't say enough good things about them.